This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're in the radiology department. Now, unfortunately, in this area we have a high prevalence of lung cancer. Today we're going to be speaking with pulmonologist Dr. Rob Geck about lung cancer screening. Well, thank you for taking some time with us today. It's unfortunate that we have so many cases of lung cancer in our area, and I guess screening has become a very important part of fighting that cancer.
Yes, actually in the last couple of years, some research has come out to show that CT or low-dose CT screening for lung cancer actually reduces the mortality from lung cancer, and so there may be some benefit to that.
Now, who should get screened?
So they looked at that, and the most important thing is finding people who are at the most risk and who will benefit from screening. So at the current time, it is individuals who are aged 55 to 77 who have a significant smoking history, so somewhere around 30 pack years. Now that can be 2 packs a day for 15 years or 1 pack a day for 30 years, somewhere in that neighborhood. And individuals that are either still smoking or have quit within the last 15 years, so they stay within that high risk time frame.
Sure. So there are risk factors involved. Are there symptoms that we should be concerned about that might lead to a screening?
No, actually, the idea on symptoms is to be asymptomatic.
Okay.
Screening is for individuals who don't have signs and symptoms of the particular situation. If you do have signs of lung cancer, like you're coughing up blood, or you're losing weight, or you're more fatigued, or there's some other sign, those are individuals that should go down the pathway of finding out, do they have lung cancer? We screen those who don't have signs or symptoms.
Okay, so what's involved in a screening process?
So the screening process starts with just talking to your doctor. Okay, you go to your primary care doctor or a specialist, whoever can do that for you, and find out, am I somebody who is at risk? Do I meet those criteria? And if you do, then asking them for the referral for the cancer screening. There needs to be a little bit of a conversation about the risks involved and what's going to happen if you have a positive result, or how does the follow-up go. And once you've had that talk, then you can go ahead with the lung screening.
Yeah, if it's determined that you need to be screened, what's involved in that process?
So at the point, you will come into the radiology room here and you'll actually undergo a CT scan, a special kind of CT scan. So it's required that we use a very low dose amount of radiation in this. So it's something that's slightly different than a typical CT scan. And it minimizes the risk, but you'll just go through this. You basically have 1, maybe 2 breath holds, and then you're done.
And if I remember right, this is a relatively new technology for Aurora here at Oshkosh, something new that you're able to offer to patients.
Yep. In the past, CT scanners were not complicated enough to do this quickly and with low enough radiation. So we've now changed our scanners so that they're able to provide that scan at a very low dose and go from there.
So you mentioned low-dose CT scan. What exactly is that?
So low-dose CT scan is actually slightly different, and so the criteria asks that it be 1.5 millisieverts or less, and that's equivalent basically to the amount of radiation you and I get in about 6 months just in the background radiation from radon and from the sun. And you can equate it to the difference of moving from sea level to at elevation, say in Colorado. That's about the difference in radiation. It should not significantly increase your risk of developing cancers of other types for that type of low dose. Still gets us good images, but reduces the risk over some other types of CTs that we do.
Right. And what happens if it comes back with a positive?
There is a huge number that come back with some sort of positive. And in those individuals, you get kind of shuffled to the side where we want to be on the trail of these positives. So we usually look at them in some manner. If they're big and they really look like cancer, we may proceed right to a biopsy of some type. If they're small and they're suggestive, you may end up getting another CAT scan a couple months later to look to see, do they grow, do they have characteristics that suggest cancer, to then necessitate a biopsy or surgical removal in that sort of a case. Get a chance to minimize the risks. Overall, there will be a large number of positive results that come back. Of those, typically only about 3% are actually truly lung cancer.
At what point would I get my results then after I'm screened?
The typical results come back within 72 hours. So the results will go to a radiologist who will read them, interpret them, then they're read by one of our specialist, either myself or my partner, and then they're relayed on to their primary care doctor or the person who ordered the test. So they'll get to them usually within 72 hours.
Yeah, so that's pretty quick, and I would imagine timing is everything when if you find a positive on that screening.
Timing is important. The biggest part of timing is anxiety. So if you're going to go for a screening test, you're going to be nervous. So we like to get you the results quickly so that that period of being anxious is at least minimized.
Okay. So can anybody schedule a lung cancer screening?
For the most part, just about anybody can do that. You need to be basically, in the case of Medicare or a licensed provider, and then go through that meeting process and talk about it, and then place the order if they meet criteria.
Okay. And in terms of insurance, does insurance cover a screening?
Most insurances do cover the screening process. It's important to call your insurance company to make sure that what your out-of-pocket costs are going to be for this, because it is a screening test. It should be covered to some degree.
Yeah, and of course, when we're talking about lung cancer and screening and things like that, of course, prevention is always the best way to go. And can you give us a couple of tips on what we can do to keep us out of the screening and the lung cancer arena?
The biggest one is just to stop smoking or not smoking. Don't start if you don't smoke, and to stop. That's the biggest way to reduce that risk. People who don't smoke still get lung cancer, but it's a slightly different rate and it presents significantly differently. If you're a smoker that smokes 30 pack years, you're 10 to 20 times greater chance of having lung cancer. So it's a significant difference.
Yeah, but if you stop now, it increases your.
If you stop now,
your chances.
it's the best way of reducing your chances.
Yeah. All right. Well, thanks for taking some time with us today.
Okay.
Now, if you have any questions regarding lung cancer or the lung cancer screenings, of course, you should see your primary care provider, or you can give Dr. Geck a call here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.